And Ellen, I'm going to go ahead and just turn it over to you. As you can see, she is part of the Department of Health and Human Services within the Division of Aging and Adult Services. So with that, I'll turn it to you, and I understand I'm going to click for you.
Okay,
Okay.
Yeah, very good. Linda. Can everybody hear me okay? I'm using the lapel mic. Is that good? Let me move it up a little bit. I can take that off. You know where I am. Okay. We'll try this and see if this works better. Okay. Thank you so much for letting me join you today. I wish I could have been here yesterday because I've been here for 2 sessions and already learned so much and learned how we can work together so much to help our folks get into housing and remain in housing and do well. So I, first of all, am not the housing expert. I don't know if there is anybody that is a housing expert, but it would not be me. But I am here to hopefully share some knowledge with you that I do have. I'm happy to hear this morning some folks talk about the targeting program and how they got their individuals into housing there. So that made me really happy because that program's near and dear to my heart. And I am a panel of 1. And I tried to recruit some of my housing friends out here in the audience and standing at the door, but they wouldn't buy into it. So. But we'll get started. I am just really giving you a real overview of housing options. And we could be here for days and not cover everything that's housing. But having said that, while we have a lot of options, it's not always that we find the exact right option for folks, and that's what's frustrating for you and frustrating for us as well. And not just with individuals with disabilities, but affordable housing is so greatly needed that there's not enough in most any area that you look. So we know it's a problem. We know that we're trying to look at the program that I deal with specifically that I'll talk about and trying to figure out how we can better utilize that. So I wish I could say I'd have an option for everybody. I know I've talked to Ashley before, and sometimes they're just not good fits or that fit can't be found as quickly as we would like. But that doesn't mean we won't quit trying, so we will continue. Talking about finding accessible housing, and what I had in the information for today was what is accessible housing, who qualifies for accessible housing, and what programs are offered for accessible housing, and how do you support someone to find safe, accessible housing. And I appreciate the presentation just prior because all of those services that they offer are so much needed with individuals moving into housing. So that was just awesome. Where to start if a person is transitioning? And you work with, my understanding, folks that have physical disabilities, mental health, developmental disabilities, so a cross range of disabilities. We do have housing that is targeted somewhat for persons with disabilities, and I'm going through the slides pretty quick, Linda, so if you don't have to, it's okay. But housing that is specifically targeted for persons with disabilities, one type is the targeting program, and that's the program that I started with in October when I was hired by the state. I actually worked with the targeting program on the other side of my life, so coming here, I came to the new side. So it's a program that I really support. I really think it's a great program, and I'm going to talk a little bit more about it. But that's one of the programs. And then we have Shelter Plus Care. And Shelter Plus Care, we'll give some more information about that. And then also HOCWA, which is Housing Opportunities for Persons with AIDS. And then the HUD 811 program. And housing might be accessible to persons with disabilities because it is income targeted. And that would be an example would be public housing, Housing Choice Voucher Program, more commonly known as Section 8, Rural Development Section 515. So you'll see there are a lot of names, a lot of numbers, and what would be ideal is if all of our programs work together with one set of rules and one set of regulations. But unfortunately, that doesn't happen that way. So we as housers don't know all of the rules and regulations for every program, so we certainly wouldn't expect some folks that are not working in housing daily to know that as well. But we will try to continue to work on that and work together. Income-targeted housing may elect to give priority to persons with disabilities. That can be in public housing or the Housing Choice Voucher Program, and that varies across the state. We'll talk a little bit about that more as well. And someone mentioned this morning about the targeting program giving a priority to MFP, and that is correct. The program does give a priority to individuals that are, and the money follows the person. So. We also do that with transitions to community living as well. So let's talk a little bit overview of the programs, and we're going to start with the targeting program. That is the program that I was hired to oversee for the state, and if I had my team with me, I'd have a panel up here of 9 housing coordinators that work across the state. They are satellite based. And so they are working in all parts of the state, western, eastern, where we cover the state. And we are also divided up in regions. I heard talking about this morning the regions. So we have our counties divided up. I have an excellent staff. Some of you, I'm sure, have talked to some of them. But that's how we cover the whole state. We try to have folks that are concentrated in regions where they live so that they know what community resources are there and how they can help individuals in their own communities. But the targeting program is an homegrown program. It was designed in North Carolina. I don't know if many of you know Julia Beck, who was with the Department of Health and Human Services. This was an idea that Julia had along with Mark Shelburne with North Carolina Housing Finance Agency. So it is very unique to North Carolina, but it has become an example across the country of a housing program that works. So we're very proud of that. But it is a partnership between the Department of Health and Human Services and the North Carolina Housing Finance Agency. We say the North Carolina Housing Finance Agency is sort of like the bank for us, but we work together very closely with them. What happens is the program, it actually does what it says, targets. It targets 10% of newly funded low-income housing tax credit projects across the state, and it's targeted to persons with disabilities. Now what that does is it gives incentives to developers to, when they say that they are going to build a complex, if they build a 100-unit complex, they are going to set aside or give us access to at least a minimum of 10% of those units. So that would be 10 units. We can also ask them to go up as much as 20%. In that case, we could get 20 units. So they are committing with the process of how they get their funding that they will target those units for us to have access to them first. Persons are referred to the targeting units by service providers that have made a commitment to participate in the program. And how that works is, and first of all, Trish and I are working on a committee. We've had a lot of conversation about this. So if you get together and meet down the road, hopefully we'll have some more information for you on this. Right now, we have service providers out in the community that we have worked with training to understand how to make a referral. And then what in turn they do is they say that they will help support that person once they are into housing. You don't ever want to move somebody in and set them up for failure in housing. And that's why all the services that have been talked about this morning are just, you know, I'm so happy to hear, because it makes for successful tenants and long term. So that's why we ask for the support part of it, so that the agency that is making that referral, they will say that if something happens, that we could contact them and have them intervene if there's a need. And how it basically works is, if, for example, if you're working with one of your folks and you know that they need housing, you complete our application. If, for example, if you're working with one of your folks and you know that they need housing, you complete our application, which is very simple, if you can believe that or not. If you've seen it, it's very simple, not like a lot of your forms and things you have to complete, I know. So the forms are completed, and you send those in to one of the housing coordinators across the state. And what happens is, if a property that you're interested in does not have a waiting list, and there is a unit already available there that would fit the need of your individual, and we ask questions such as if they have a physical disability, do they need the special bars, anything, wider doors, whatever their needs are, we have that indicated so that we know we can make a good match or fit for a unit that becomes available. But if there is a unit available, we contact you back as the referral agency and say, there is a unit available at ABC Apartments. Is your individual still ready to go? And are they, and the folks didn't go through it, but are they housing ready? Have they got things in place? Have they got their birth certificates? Have they got their application fees? Whatever all those things are, their documents, are they ready to still go into independent housing? And if you say yes, what happens is our staff, our housing coordinators, they send that referral to the apartment complex. And what that does is it protects the confidentiality of the individual that you're working with, because the apartment complex only needs to know that this individual has a disability. They don't need to know what it is. They don't need to know if they have a diagnosis of schizophrenia or whatever they may have. They don't, that's not something they have to know in most cases. So once we have sent that referral to the apartment complex, then, you would, just like you or I, your individual would go to the apartment complex and make an application. And this is where some of our barriers are. A lot of the individuals that we work with, because of their disabilities, have had some issues in the past with maybe their criminal and credit history. And so those are barriers that we are still working to try to address with these apartment complexes and their management. Because apartment complexes are owned and managed by various folks across the state, some of the policies vary a little bit. But pretty much it's very difficult to get someone in an apartment complex that is a sex offender, and then any of those that have violent criminal felonies. Those are very difficult. But we are working with apartment complexes with various kinds of things to say, we know that you may be taking an extra risk with some of the folks if they have a credit issue, and we're putting some things in place to try to help them kind of not see that they might have as much loss if something did happen with that tenant. And I'll give you an example of that. And Tricia and I have talked about how happy we are about this, but if you move an individual into a targeting unit that has key assistance, and I'll tell you a little bit about key assistance, we are currently paying the deposit for that. So you would not have to come up with money for a deposit, which is huge when you're trying to get a person moved in. Lots of times, as the folks said, they don't have furniture, they need linens, they need pots and pans, they need everything. So any of that we can pay is so good. So we're happy. We just started that actually last year. It's not been in existence the whole time, but we do pay the deposit for key assistance. We have not been able to figure out a way to pay the credit and credit check and the application fee. And the reason for that is because the person may not ever end up as far as in occupancy, so there may not be a lease. So therefore, the funds that we have for that, we don't have a pot of money right now that we can just use in general, but we're working on that. So hopefully down the road we'll be able to help with assistance for that too, because that's a barrier for people as well. We had somebody this week that said they couldn't go to a complex and apply because they had to wait to the 3rd when they got their check. So, and the unit could be gone. So it really is a barrier when you're working with individuals, and we realize that. So that's something we hope we'll be able to get in place as well. But the other thing we're doing is we're calling it kind of a special assistance thing, where if a person moves out and they don't pay their rent, so they leave a property owing money for rent, or they cause some damages when they move out, we have set aside some money that we can pay that. So that gives the landlord that little bit of extra kind of cushion that they are willing to go out a little bit more out of their normal boundaries to try to assist our individuals that we're working with. And the other thing that we have in place that a lot of people don't know about, that we haven't had to use that often, but we have access to, is a holding fee. So if you have somebody that's ready to go almost, but something has happened, they need to, stay where they are for an extra week or 2 weeks or whatever, various reasons why that would come into effect, but we can pay a holding fee to hold the apartment so that it is not taken by somebody else. So those are a couple things that are fairly new that we put into place. But the targeting program, get back to my slides here, the goal of it is to connect low-income persons with disabilities who are receiving supportive services to housing that is affordable, safe and decent, permanent, integrated in the communities, accessible, and independent. There is a lease in this type of housing, so it's definitely considered independent housing. Somebody talked earlier about somebody moving into a brand new unit. We have brand new units. We are building, complexes are being built across the state. We are almost in every county, not completely every county, but every day new units are coming online. So properties are being built, brand new, very nice properties that your individuals can get housing in. So some very nice complexes that are being built. So there may not be something in your area today, but if not today, maybe coming online. So that's good. We've got new units that we can get folks into. I have some links that I have incorporated here, but they're not going to be useful for you because they're not active in your handouts here. So my administrative assistant, which is my daughter, I can't fire her. She's helping me, so we'll figure out a way. I've already talked to Trish about how we can figure out a way.
Yeah, and a couple of things. We're going to post them in our learning community, and also if you can spell out what that acronym means, people can Google it and find it directly. North Carolina Housing Finance Authority Agency, Housing Finance Agency, right? If you NCHFA,
North Carolina Housing Finance Agency.
If you Google that, that is going to be a wealth of information and resources about what Ellen's talking about.
Mm-hmm. And I think the resource page that I compiled that'll be at the end of the presentation may not have everything that's in the PowerPoint, but it has a lot of those listed there for you as well. But targeted units, there's the link for that, and then we have a website for targeting units. I have my contact information here. Please call me, email me, whatever, and we'll have time for questions here in a minute if you have some questions about the program. And if you don't know who your housing coordinator is in your region, please email me, ask me, let me know, and I can tell you who that person is. That will be your new best friend. And the staff are there to assist you and help you in any way they can to find housing. Just by show of hands, has everybody heard the term targeting program before today? Some have not, so that's why we don't want it to be the best kept secret. We want everybody to know about it. And one more thing I'll say about that before I move on to cover some of the other topics is people refer to it as the targeting program / key program. You might hear those terms intermittently together. But what it is, basically, the targeting program is the access to the units. That's where the properties have set aside the units, saying that we will set these units aside for you, for folks with disabilities. The key part of it is actually the funding. That's what makes it affordable. That's the money part of it. So just a little bit of clarification on that. It's a little bit, sometimes they go together so well that they get put together and linked into like two different programs, but it's not. Talk a little bit about Shelter Plus Care, and some of you are here from MCOs, LMEs. You may have some of these grants in your agency. A lot of the Shelter Plus Care grants are within LME MCOs, but this program provides rental assistance for homeless people with disabilities, primarily those with serious mental illness, chronic problems with alcohol and drugs, or acquired immune deficiency syndrome and related diseases. I actually have worked with Shelter Plus Care in an LME MCO arena, and the grants right now are no new grants are being awarded as far as HUD is said, but the existing grants are being renewed. Most of them are being renewed. So if you've got somebody homeless, I think Becky said earlier she was helping some folks get out of the shelter. That might be a good option for them with the Shelter Plus Care. They do give priorities for different ranges of what's considered homeless and different needs, so that may be a very good option for you to check with your LME MCO if they have the grants. Not every LME MCO has the Shelter Plus Care grants, but a lot do, so that would be an option if you have somebody that is actually homeless. And I had the link there for the LME MCOs if you needed to know who to contact for that, and also a link for HUD for Shelter Plus Care. That is a HUD-funded program. And then there's also another federally funded program called HOPWA, or Housing Opportunities for Persons with AIDS. This is the only federal housing program solely dedicated to providing rental housing assistance for persons and their families living with HIV/AIDS. It has supportive services are provided as a part of the housing, and it is designed to help persons maintain housing stability, avoid homelessness, and improve access to their treatment that they need. So that's a HOPWA program that is special, a very specialized program. And I have a link there for information for that as well. And like I said, I'm just giving you a real high overview of all the programs and where you maybe can access resources or contact us as well for information. The other program that is a HUD program, and HUD is the Housing and Urban Development Agency. It's the federal program that really houses a lot of the housing programs and funding for housing. And the 811 program, it's also supportive housing for persons with disabilities, and HUD provides the funding to develop and subsidize rental housing with the availability of supportive services for low and extremely low income adults with disabilities. The program allows persons with disabilities to live as independently as possible in the community, and the rental housing is subsidized. Right now, we currently don't have 811 in North Carolina. The 811 program, HUD actually designed it based on our targeting program. So while it's based on our program, we don't have it in North Carolina. That doesn't make sense. But there's some good reasons for it. HUD had set out a lot of rules and regulations for the 811 program, and right now, North Carolina didn't feel that we could meet all of those rules and regulations. So we're hoping as HUD gets it out in the communities more, they'll realize that all those things can't be met. So we're hoping that that will be on the horizon. We will have 811 funding. But that's a little bit about 811. It's not currently in North Carolina right now. And now I just want to talk a little bit about housing for persons that are older adults. There is a supportive housing program for elderly. It's called the Section 202. That's the HUD number that's given to the guidelines, Section 202. It provides capital advances and contracts for project rental assistance to expand the supply of affordable housing with supportive services for very low income elderly persons. Section 202 can be new construction or it can be rehab. And it's also a HUD-funded project, and have a link there for that. Also, housing for persons that are older adults can be embedded in other housing programs, such as the targeting program. We have properties that have specific age requirements, some 62 and older. One issue that we're having now is if newer funded projects now, if they have an age requirement, typically it's 55. And in some cases that could be as low as 45, even if the property says it's 55. So the age thing varies across the state. but we could tell you if a property is family, elderly, or whatever the requirements are for the age. The Housing Choice Voucher Program also gives some programs across the state give priority for folks that are older adults, and also public housing does as well, and that varies across the state. Housing might be accessible to persons with disabilities because it is income targeted. That can be in public housing as well, or the Housing Choice Voucher Program and Rural Development Section 515. So we'll talk a little bit about public housing. Most of you probably are very familiar with public housing because it's been in existence for a very long time. The thing with public housing, and HUD is actually replacing a lot of their public housing with more integrated housing, so it's not as much site-based. But typically, if you ride in your neighborhood, you probably would be very able to identify what public housing is. It's congregated housing, units together, built together, and that, you know, really gives a, it's not as desirable now because the stigma that has come with that of being identified as public housing. So HUD has seen that and is actually getting away from a lot of the public housing whenever some of the units are actually being torn down and being rebuilt with integrated community housing. So, but public housing is a very viable option, and I'll give you a little bit of information about some of the housing authorities. But public housing was established to provide decent and safe rental housing for eligible low-income families, the elderly, and persons with disabilities. And it comes in a variety of shapes, forms, and fashions, and some public housing authorities have complexes that are specifically designated for elderly. And so they can do a little bit of different things in their own communities with the rules and regulations and how they set that up. But I have some resource information there for you for public housing and public housing authorities, and where you can locate those in your community. A lot of you may know where those are in your communities now. It varies a little bit across the state too of where they're located, but I'll give you some numbers on that. Probably maybe one of the more wider known programs is the Housing Choice Voucher Program, or a lot of people refer to it as Section 8. The Housing Choice Voucher Program, it's the federal government's major program for assisting very low income families, the elderly and disabled, so it can be all populations. And what the program does, it allows the individuals to be issued what we call a voucher, and that gives them the opportunity to go out into the community and find their own unit. It can be a house, it can be an apartment, it can be a mobile home, it can be, as long as it meets HUD housing quality standards. So you, I'm sure, ride by every day in your communities, units, homes that are being subsidized with Section 8 vouchers, and you would not even know it. We say in the housing world that the Section 8 voucher is, or the Housing Choice Voucher is the Cadillac of all housing. If you ever have the opportunity to work with your individuals in any way to get their names on a Section 8 Housing Choice Voucher waiting list, please do so. It may be that your person or individuals already have housing, but if you have the opportunity, and I say that because a lot of the housing agencies have their waiting lists closed for Housing Choice Vouchers, and the reason for that is because the demand is so high. Some authorities have waiting lists as long as 5 years or longer, and so they don't open up for applications all the time. And what they're supposed to do is to notify by public notice in the newspapers. Sometimes it's a little print about that big that you can't see very well unless you're eyeballing. But they do have to notify public notice that they're going to be opening their list. Lots of times it may be for 1 week, it may be for 2 days. So sometimes the time frame, the windows are very short. But if our staff knows, if we find out, are notified that any Section 8 agencies, PHAs, are opening their waiting list, we try to spread that word out. So if any of you know that in your communities, it's helpful if you can share that. And so there's because of the need, the Section 8 vouchers are harder to come by now. And once a person usually has one, they don't typically give it up unless there's some extenuating circumstance. Recently, we have encountered, though, when I say the Housing Choice Voucher or Section 8 voucher is the Cadillac of all, you could go anywhere. You could take it with you anywhere. You could actually live somewhere for a year, and if you wanted to live in North Carolina and you decide you want to move to California, you can take your voucher with you to California. Most agencies don't want you to know that because the difference in rents in different areas, but technically you would have the opportunity to take your voucher with you, so it stays with you. It's assistance that goes with the individual that has it. But because of that, the portability of it, that's called portability, that's one of the other reasons why it's the Cadillac of housing. So that's why I encourage you, even if your individuals are in stable housing and you find out that the Section 8 or PHA in your area is opening their wait list, please get your individuals on the waiting list, because things can happen, and once their name is reached on the list, they could still have the opportunity to go out and find their own housing. So it's really the Cadillac of housing. The vouchers are administered locally by public housing agencies, or PHAs. A family that is issued a housing voucher is responsible for finding their own suitable housing unit of family's choice where the owner agrees to rent under the program. So it can include also the current residence that a person is living in. So if they're renting from a private individual and they want to stay there, and that owner of that unit is willing to participate in the program, then they can stay there and lease in place. So that's another good thing about the program. Currently in North Carolina, there are 125 PHAs across North Carolina, and out of that 125, 27 of them only administer the Housing Choice Voucher Program, 57 administer only a public housing program, and 41 operate both. So you can see that varies across the state with what your agency may administer, if it administers public housing and Section 8. Lots of times they go together, but some of the smaller public housing authorities only use or only work with public housing. And have some resource links there for that as well. Next, I want to talk a little bit about rural development. Rural development section 515, that is very low and moderate income families, elderly persons, and persons with disabilities. So that covers pretty much everybody. Are eligible to live in section 515 financed housing. And the last data that I had is of April 2010, 60% of all the section 515 tenants were elderly or disabled. And this is administered by the USDA Rural Development. And I have a link there from North Carolina, and actually a link there where you can go and search by county where these properties would be located. So a lot of these links actually have housing searches in them, where you can go to click on your county, your region, your area, and find the units that are there that are listed for these different types of programs. So if we have a minute before we go to the next step, can we ask for questions right now, Trish, for any of the housing programs that I've hit the high spots on? Where's my panel at?
All right, and Rena, you take the back section, and I'll take the front section, all right?
And I have a feeling I know what some of the questions are going to be. So
maybe we should have you guess what the questions are going to be. Well, okay, there you go.
My question is for public housing for the elderly, 55 and above. I've got a barrier right now. A gentleman is in a less desirable housing unit, and I found some public housing that fit his criteria, but the requirement is that he needs to come in and make the application. They need to see him in person. He's a quadriplegic in an electric wheelchair, and he can get to the doctor, uses public transportation. Family, can take him on load to rent, but we don't have a vehicle source to get him to each place to make an application.
have you asked for a reasonable accommodation because of his disability?
I haven't gone back individually and to, you know, kind of plead my case in a professional way, but each one I asked said that he needed to come in. They actually needed to see the person that was renting. And I did say he had a disability and it may be difficult.
I think with, and it's been a while since I did Section 8 and public housing, but if there is a need that an individual has a disability, my understanding from my days back, and Angela has done public housing, so she may tell me, they would have to make an accommodation, your person. They would have to go out and actually do the application with the individual then in that individual setting if they cannot come into the office.
Okay.
They cannot restrict them from applying just because the individual cannot physically come into the office. Is that right?
Right, that's correct. And I know in the past, there's two ways that you can actually work that. They can either come in and do a site visit, a home visit, or in addition, they can get a family member or some type of support to come and pick up that application for him.
And that's what I was, hopefully have a representative or to go and do it. Okay, I appreciate that.
Don't let that go. You have the right for that person to be able to apply whatever the accommodation they need to make for them.
Oh, wait a minute, Angela.
And in addition to, if you can't meet to some common ground, you can always call the local field office, HUD field office, and see if you can broker some kind of deal that way, and hopefully you could get to that.
Which county are you with? Which county?
Cumberland County.
Cumberland County. Do we have anybody who, either from IL or anybody who considers themselves experienced in how to do reasonable accommodation requests? Anybody here? If you talk, Pam, can you raise your hand? Okay.
Pam's over here.
If you want resources about people who are experienced in doing reasonable accommodation requests, the local independent living networks can help you do that.
Yeah, we had 16 offices across the state, DVR, IL, and Fayetteville office is what covers the IL program. I don't know if the book has our listing address information, but we can be sure that it goes on the learning community website. But the IL offices are able to assist with that, to make the reasonable accommodations and to modify the homes and apartments if necessary. So Fayetteville IL office will be your main contact, and if it's not in the book, we'll be sure that it gets on the learning community website.
Yeah, and just let me say, as Angela said, the HUD field office for North Carolina, there's only one, and it's in Greensboro. But yeah, the HUD field office in Greensboro oversees the public and the housing choice voucher program in North Carolina. And for our targeting program, just a thought there, we have lots of targeting units in Cumberland County, and we have not had a regional housing coordinator for that area and the Lumberton area, Robeson, Bladen, Columbus, Scotland counties, but we are in the process of hiring one right now. So we will have somebody on the ground, feet on the ground there pretty soon. And so that hopefully will be a big help for housing resources in that area. We have been very lacking in being able to be active in that area because of not having an individual there that can concentrate in that area. So that's exciting. I'm glad to hear that. Yeah. But there's lots of apartments in Cumberland County.
Another question.
If a person has lived in housing before, and let's say something has happened, they moved out of housing, but something has now happened to make them qualify as disabled or what have you, can they re-qualify to go back into housing again? Or is there, if you lived in there once, you can't go back?
Now, when you say housing, do you know what type, a particular type?
Well, I have a patient that I see who, all she told me is that she used to live in public housing at one point.
Okay.
And this was years ago, she said.
Okay. What happens with that? Lots of times in public housing, well, I think now it's kind of a rule. In public housing and Section 8, if an individual moves out and they have some kind of violation, they leave owing rent or they leave owing damages, or if they didn't give a proper notice, the housing authority or public housing agency keeps a list of all of those individuals, and they do share that among other PHAs. So your individual may be in Wake County now and they moved out and maybe left damages. If they try to go to Cumberland County is pretty much going to know that they have had damages in that other housing complex, and they usually will not accept them for a new rental unless sometimes they can make repayment agreements to pay back if it's damages, and they will still allow them to go ahead and move in, but lots of times they will not until all of those damages are paid. So yeah, that's why it's very important. That brings up a good point, that it's always very important to have your individuals, if they do need to move out, to do it on all the terms that they possibly can, like giving the proper notice, and if they know that there's going to be damages, maybe making some kind of arrangement at that time with the landlord to pay back, because it's going to follow them. And when new owners do rental checks or rental references, that's going to be on their information, especially if they're evicted and they have to go through that eviction process in the legal system. It's always very negative. It's hard to overcome, but you know, sometimes you don't see that when you're going through those obstacles. But did that answer? Yes.
I have a question. Hey, working with the Center for Independent Living, I want to talk about the target housing. Can I make a referral with my consumer that could use the targeted housing and work with them to get and secure target housing, especially say if it's a transition?
That is the conversation that we have been having for many months now. And what we're trying to figure out, and it sounds like it would be simple, but it's really not. What we're trying to figure out is how we can open up the referral network to have your centers and others that are supporting people to be able to make referrals that are not doing that now. But in that vein, how are you going to be able to continue to support somebody once they move into housing? And I know obviously your agency does with all the things that you're doing. But yes, I would need to talk to you. We're trying to open up the referral process, and we're also trying to make it transparent so that people know where to go to apply for targeting housing.
Okay, can I make a comment?
You sure can.
Back when targeted housing started, and this was back, I can't remember how many years ago now, but the Centers for Independent Living were brought on board. And I know that at that time I was working in the western part of North Carolina, and we were bringing folks out of nursing homes and putting them into target housing, and we were providing those supports. You know, we weren't just bringing them in, and we were told by some of the housing properties, you know, the Centers for Independent Living were bringing the folks there, providing the supports where other agencies that or organizations that were bringing them there just said, good luck. So I think that needs to be revisited, and I know we've tried, and it's fell upon a deaf ear, but
That's not.
that would really open up a lot of opportunities for transitions in what we do.
I'm gonna weigh in here just to make sure that people hear what Ellen is saying. Is that challenge that emerged about what 3 or 4 years ago when that process is being revisited? Period. We'll see what happens. I mean, but we are examining how to, and we have said, listen, it's important that the right referral entities be able to make referrals to make this process work. So it's being revisited in a very positive way.
Yes.
So.
And we realize that that's a barrier, and we realize that, you know, there are a lot of good folks out there that could be making referrals. So the system is not perfect, and really what has happened, when the program was initially designed, it made sense, but because all of the services, behavioral health has changed so much, all kinds of services that your folks can get have changed so much since that time. Our program has not kept up with those changes pretty much, but we realize that, like Trish said. And see, I've got a witness. We know. I know exactly what you're talking about, and we have had quite a bit of discussion. So next time I see you, hopefully I'll have a different.
There'll be some
story
good news.
for you.
Ellen, good morning. Talk to us a little bit more. I've actually got 2 cases I'm working on transitions now that I'm interested in knowing more about this holding fee.
Okay.
Is that another application process? Is that
No.
another form? Is that a call to our local housing coordinator?
The call to your housing coordinator.
Okay.
It's not a form. It's a call, communication to your housing coordinator.
Thank you very much.
You're welcome.
What about if a family with a disabled head of household is looking to own a home instead of rent, or they want to buy a home, is there any programs for them or assistance with the down payments being so large and that type of thing?
There are, and I'm not as familiar with those programs. So I said in the beginning, I'm a housing expert. So I am not as familiar with the buying process, but I know North Carolina Housing Finance Agency has lots and lots of programs, and they have some, and also foreclosure. I talked to somebody this week. If you have somebody that you know that is in possibility of foreclosure, losing there's funds, there's money that the federal government has set aside for that. So I would say North Carolina Housing Finance Agency would be your best contact for that.
Ellen, I think it's probably, you have a few more slides.
Yes.
And this was a significant pause. And it was great because you got a chance to really get some meaty questions.
We'll go through these real quick. And this was because of the interest, I guess, you had as far as the session today. How does a live-in aid impact eligibility? And let me just give a little preface here. We are, when I say we, our program, the targeting program, is very in tune to what the needs are for individuals that need supports with disabilities. But from our side, I just want to share one thing. While we have some of these are actual HUD regulations that I'm sharing with you today, so it's not anything I made up. But we are seeing a lot of what we call abuse of individuals that really get into bad situations because people take advantage of them. They get into independent housing, and then everybody in their family wants to move in. And it causes a lot of issues for folks that have disabilities, sometimes that can't even stand up for themselves against even sometimes family members. So there are some very set rules in place to kind of impacting what a live-in aid is and what is considered a live-in aid. But this is HUD guidelines. This is not Ellen guidelines. Verification that a live-in aid is needed to provide the necessary supportive services to essential care and well-being of the person, and that has to be obtained from the person's physician, psychiatrist, or other medical practitioner or health care provider. And I recently had somebody ask what constitutes a health care provider. I searched HUD regulations. I didn't find that defined anywhere clearly, so that could be up for debate. I think somebody wanted to have their psychologist or social worker or somebody sign an MSW or LCSW sign saying that the person needed it, but I can't give you clear direction on that because I never found a clear direction in the HUD guidelines. How does a live-in aid impact eligibility for housing subsidy? If you have a person that has the live-in aid services and they're having to pay for them out of pocket, if they're not reimbursed by some form of payment, that individual can have that counted as a deductible expense from their income source so that their rent would actually be lower if they're paying out-of-pocket expenses for those kinds of things. How does a live-in aid impact eligibility for housing subsidy? And this is the part that we kind of run into problems with that I just shared a little bit about. A live-in aid qualifies for occupancy only as long as the individual needing the supportive services requires the aid services and remains a tenant. The live-in aid may not qualify for continued occupancy as a remaining family member. If you have the head of household that passes away and then there's a live-in aid that has been living in that unit, they are not entitled to stay and have rights to that unit. And what happens is apartment complexes or owners usually sign a lease addendum that has that very clearly spelled out, but we do run across that quite frequently where individuals want to stay whenever they're not entitled to the residency. Income of a live-in aid is excluded from annual income for rent payment share. So if the individual is getting paid to be that live-in aid, then their income is not counted as a part of the household income when it comes to calculating the rent based on income. It would be excluded. And the other question I think that was raised was how does having roommates impact eligibility for housing subsidies? And I appreciate folks that sometimes that would be a good situation for them to have a roommate. Roommates with disabilities and roommates without disabilities, depending on what you can afford, sometimes is the reasons for doing that, what your needs are, and they touched on that in the session. Everybody was touching on that just a little bit earlier in the session before, about what a person's needs may be in order for them to need that assistance for a roommate. And possible reasons for wanting a roommate: companionship, help with living expenses, and help with supervision needs. And of course, each person has a unique set of needs that will influence whether a roommate situation is needed and whether or not roommates would be considered a household member and would be included on the lease and have the same obligation as a lease. So if a person has a roommate and they're counted as an equal in the household, then typically they would also be a party to the lease. Their name would be included and on the lease, and they would be as obligated. And their income would also be counted as a part of the total household income for calculating the rent subsidy. So that's a high overview. And did we run out of time?
We actually do have a few minutes now, again, and so looks like, Reno, you got some people in your territory there.
Okay.
All right, right over there. Yeah.
So one of the barriers that I run into most, well, there's many, but just one in particular is around definitions of homelessness. So when I'm working with young adults, often I see homelessness as a medical necessity, and by allowing them to become sheltered, that can lead to hospitalizations depending on their traumatic backgrounds. So what I'm wondering is, can you talk about defining homelessness? If I've got a young adult that's technically homeless, they might be couch surfing, or I may have found them someplace temporary, but they are homeless. And I'm trying to keep them placed so that they can get delivery of effective treatment and possibility for other access points. And then the last question I have is around targeted housing and the minimum income. So if SSI is not there, what is the minimum, the least amount someone could make in order to get housing under the targeted housing program?
I'll answer that one first because that's easier. $300 is the minimum income. And I will add a caveat: if you have an individual that does not have that $300 minimum, because it's a program we designed, we do have a few what we call waivers in place, that if there's special situations where that income is going to be in place, or there's a lot of different reasons, but you can contact us and talk to us, and we can let you know if there's any options available. But it is set at $300 for minimum income. And as far as the definition for homelessness, that depends on really the HUD program or whatever program you might be working with. Some programs have one definition for homelessness. HUD has a different definition for homelessness. And typically, couch surfing is not considered homelessness. While you and I definitely know that it is, because a person does not have a stable housing, but to HUD, couch surfing is not considered homeless. HUD, before I left the LME MCO, published a very extensive document. I think it was about 8 pages long, defining homelessness. So I'm not going to definitely be able to quote all of them to you, but it is based on really the individual's need and what, for example, if they have a severe medical or behavioral health need, then that would top a person having just a, not just, but having a severe behavioral need. It's kind of stacked on what's considered the most severe, and it goes down, and they have it very specifically designed. And that really applies to shelter plus care, as that's one of the definitions for homelessness that covers that shelter plus care has to go by. But HUD has a very stringent, specified new homeless definition. But
so would you say it's tiered? It's kind of a tiered?
Yes, it's in tiers.
Mm-hmm. Mm-hmm. All right. Any other questions? Yeah.
Can you clarify the $300 for targeted units? Can that be income, or does it have to be disability income?
For the targeting program, currently, the rule is that the head of household does need to be an individual that has SSI or SSDI as their form of disability. And the reason for that, I'll just be real honest for you right now, the reason for that is because that's a definite, when they have that income in place, then that is a definite show that they have been declared disabled if the Social Security Administration has declared them disabled. And so yes, right now it is SSI or SSDI. But there again, if you have an individual that has applied for SSI or SSDI, you know, you can let us know that. It may not be that we could get them moved into a unit right away because of that, before that comes into place, but we might could get them on the list.
The individual is disabled, but they're working. That's their income.
Okay, so their wages are their income. Yeah, that wouldn't work. I'm sorry.
On a side note for that is, what about VA disability that does not get SSI or SSDI?
VA disability we can work with.
Okay, I have a feeling that lunch is on people's minds. But before we go to that, let's please thank Ellen. And Ellen, I wish I had a crown that said housing expert on it, because you started with a disclaimer that you are not a housing expert. But
No.
if you're not, I don't think there is one.
I'm not, but I'm like you. I have a passion for helping people, and housing is a very basic need. So I'll never be an expert, but I won't quit trying to help.
Thank you so much.